Hello guys, welcome to Two Doctors Travel's Healthy Heart series. This is Dr. Hashmi and I'll be speaking about hypertension, the complications it causes and the ways to prevent it in this video. So let us quickly start with knowing what hypertension is. If you get your pressure checked and if anyone gets a value above 120/80, it's considered to be abnormal. So to have a normal blood pressure reading, your blood pressure value should be below 120/80, in which the 120 value is the systolic blood pressure and 80 is the diastolic blood pressure. So, if you get a value above 120/80, the person is labeled to have elevated blood pressure. For a person to be labeled as a hypertensive, he should have a blood pressure value above 130/80 and the blood pressure values should be taken two times with a gap of 1 to 4 weeks between it. And when you measure the blood pressure of the patient, he should have taken 10 minutes of rest before it, and it should not be post exercise or emotional stress. The stages of hypertension are two. If the blood pressure value falls in the systolic category between 130 and 139 and diastolic between 80 and 89, the person comes under stage 1 of hypertension. If the blood pressure value is above 140/80, he comes under stage 2. There are patients who have isolated systolic blood pressure hypertension and isolated diastolic blood pressure hypertension too. Let me move on to the risk factors that put the patient at a greater probability of having hypertension in the future. I would broadly classify the risk factors as modifiable and non-modifiable. The non-modifiable risk factors are things that you can't work on, like a positive family history or advanced age. Advanced age puts you at a greater risk of hypertension too. Let me talk more about the modifiable risk factors like obesity, diabetes mellitus, uncontrolled diabetes mellitus, followed by smoking, increased alcohol consumption, having diets that are having increased values of sodium and decreased values of potassium. So, if you want to work on your modifiable risk factors, you can try to keep your weight between the BMI category and value of 18 to 24. If you have diabetes, you can keep it under control. You can quit smoking, decrease the alcohol consumption, and work on the diet meticulously to decrease sodium. I'll be talking more about the diet in the last few slides. Let us move on to what hypertension does. Hypertension is a silent killer, and most of the times at presentation it doesn't have any symptoms, and if it does, the symptoms are non-specific, which are generally overlooked. The non-specific symptoms are headache, dizziness, tinnitus. So tinnitus is a ringing sound in your ears, and also chest compression. Once a person is diagnosed with hypertension, he needs to follow it very closely, as hypertension can start organ damage if left uncontrolled. Uncontrolled hypertension can lead to strokes, which can be both hemorrhagic and ischemic, followed by chronic kidney disease and heart failure. Let us move on to how we can prevent and what has been recommended, the ways that have been recommended to prevent hypertension. The number one thing that has shown to decrease your blood pressure is weight loss, followed by following a diet called as the DASH diet, which has been specifically designed by the NIH to reduce and curb hypertension. It has a lot of greens, vegetables, fruits in it, and a bit of dairy products too. Followed by consuming a diet which is low in sodium, decrease the alcohol consumption. and lastly, exercise. I have previously spoken about what kind of exercise should be done, what is considered as exercise for improving your uh, cardiac capacity and benefiting your heart. Let me move on to the role of nitric oxide in blood pressure regulation, as this will come in handy when I talk about things and vegetables that need to be consumed to decrease your blood pressure. So, when you are in stress or you exercise, if you imagine this is your blood vessel and this is the blood, and when you exercise your blood flow increases, the normal response to this is your body dilates the arteries, and this is called flow mediated dilation, and for this you need nitric oxide. If the flow mediated dilation doesn't take place in times of stress, your blood pressure value significantly increases and a new baseline is set. So there are two situations in which the flow mediated dilation doesn't work. One is there is decreased nitric oxide levels. The second is there is damage to the artery walls that doesn't allow it to dilate. It might be due to lipid deposition, that is atherosclerosis, or it may be due to aging of your arteries called as arteriosclerosis. Let me move on to the next slide where I will speak about the diets that put you at a greater risk of having high blood pressure. So, the number one thing that increases your blood pressure value is salt. So, this is present in things like chips, bread, cheese, French fries, followed by alcohol. The next category of foods that put you at a risk of becoming hypertensive and increase your blood pressure is foods that have high fat content, like meat, fish, eggs, oil. The next category that increases your blood pressure is any kinds of oils that include olive oil, coconut oil, or canola oil. Followed by dairy products. The dairy products, because they have got high fat content and some of them have also got high salt level, increase your blood pressure. These include cheese, milk, ice creams. The last three categories, that is high fat category, oil, dairy, they cause increased blood pressure because they decrease the nitric oxide levels in your blood that cause decreased flow mediated dilation. A decrease in the flow mediated dilation in turn causes your blood pressure to rise. Now, how can we eat and what can we eat to decrease our blood pressure? The number one thing that is recommended is eating food that is rich in vitamin C. Foods like citrus fruits, kiwi, strawberries are rich in vitamin C and kale. Next is eating foods that are rich in potassium. Foods that are rich in potassium are spinach, watermelon, beets. Drinking vinegar has also proved to decrease your blood pressure. All kinds of vinegars decrease your blood pressure within hours. The next category is green tea, followed by eating plant-based diets. To be specific, you need to have vegetables that are rich in, or I mean, that increase the nitric oxide production in your blood vessels. These vegetables are spinach and beets. So you can incorporate these vegetables in your diet so that there is a decrease in the blood pressure by increased nitric oxide production. Let me just talk before I end this lecture on how much amount you need to eat uh, so that you have the benefits. If you are planning to eat spinach or you're planning to eat beets, you need to have around 1 to 4 cups a day. But if you plan to eat radish or stuff, you need to have at least 2 cups a day. And these have shown to have benefits. These have been proven to have benefits in terms of decreasing your blood pressure. So that's all for this video. Hope you liked the content and found it informative and you incorporate it in your diets and reap the benefits. I would appreciate it if you could like the video and share it with your family and friends, and subscribe to my channel, Two Doctors Travel. See you in the next video. Thank you.